Thank you again for the great introduction. And my research is on a comparative study of anti-Asian racism in Canada in the context of the COVID-19 and the SARS pandemics. And I chose this topic because both of these pandemics originated in China, which is to say that the virus started in China. And in both cases in Canada, there was explicit linkage of both COVID and SARS to China, which resulted in spikes in anti-Asian racism here in Canada. So I'm going to go through some of the findings that I've discovered in terms of similarities and differences. So firstly, anti-Asian racism during COVID far surpasses what we have seen during the SARS experience in 2003. And this is measurable in terms of reported racist incidents, anti-Asian rhetoric in the media, both online and offline, and in terms of negative economic impact to Asian and Chinese-owned businesses. So for example, in March 16th, 2020, even before an emergency stay-at-home order was initiated, restaurants and businesses in Chinatown saw up to 85% drop in profits. And this is even before, everybody started taking it seriously. And this happened during SARS as well, in that Chinatown was sort of seen as the epicenter of disease, and Asian people were sort of seen as a source of it. And so we can say definitively that these two pandemics exacerbated existing racial divisions and scapegoated Asian Canadians. And the fact is, anti-Asian racism overall is on the rise. And as the previous panel talked about, it's not just racism against Chinese people, it's racism against everyone who looks Asian, whether it's Chinese or Korean or Vietnamese, or just everyone that looks Asian. And in terms of media representation, we can see in both pandemics that the coverage of these infectious diseases disproportionately focus on their linkage with China. So with COVID, it's been focused on uncommon Chinese culinary practices like eating bats. And this is what happened as well during SARS, with the media linking it as the Chinese virus, which led to the public perceiving Asian people as higher risk for getting the disease. And so it seems like 17, 18 years later, Canadian society is mostly repeating the same thing as what happened during 2003, but on a bigger scale. However, there's good news in that we are significantly more prepared this time to deal with this increased anti-Asian racism. And it seems like we're really applying the lessons that we have learned during SARS. So in particular, we can cite better reporting of racist incidents, as well as stronger community organization. And in that the Asian Canadian community is more unified this time to handle the increase in anti-Asian racism. And this is one of the causes for that is the stronger community organization efforts of advocacy groups, both online and offline. This includes social media groups such as the group Subtle Asian Traits on Facebook, which is the group I think that has 1.9 million Facebook users and allows Asian people to commiserate about their experiences. And in terms of advocacy groups in Toronto and in Ontario, I think there were I can cite two initiatives that were launched by Asian Canadian advocacy groups, including Project ProTech, which is an educational and awareness-raising initiative that seeks to build resilience within the Asian Canadian community, as well as these covidracism.ca or Fight COVID Racism website, reporting tool and podcast and more information which was launched by the Chinese Canadian National Council, Chinese Canadian National Council for Social Justice, Chinese and Southeast Asian Legal Clinic, and the Civic Engagement Network. And it's true that these groups have had tangible impact on supporting Asian Canadians during this pandemic, in particular with providing resources that are not in English to those people who might not might need that, who might not be able to get this information otherwise. And this is something to be celebrated. As well, I want to talk about the influence of social media during these two different pandemics. Well, during SARS, social media like Facebook and Twitter, and it didn't really take off, so it had a negligible effect. But during COVID, we can see that social media has had both a positive and negative effect in terms of anti-Asian racism in Canada. So we can look at Twitter, where we can see hashtags like hashtag Chinese virus or hashtag Asian virus or Kung flu that as we can see are associated with increases in anti-Asian racism, but they can also be used for positive community organizing purposes with, for example, with organizing rallies or the hashtag Stop Asian Hate. So there's good and bad to social media in combating anti-Asian racism. As well, I want to mention that the legal and political environment for these two pandemics is very different. So back in 2003, race issues was not as prominent as it is now, in the sense that now in 2020, 2022, people are significantly more aware about race issues in a way that many people weren't back in 2003. And now we have legal protections from all three levels of the government, the federal, provincial, and the municipal levels, anti-racism legislation that didn't exist back then. And while they're not perfect, it's a good starting point. So, for example, at the federal level, in 2019, the federal government initiated the Building a Foundation for Change, Canada's Anti-Racism Strategy 2019 to 2022, which invested $45 million into various anti-Asian racism anti-racism initiatives over 3 years, including establishing a new anti-racism secretariat, in addition to funding new community-based action and education programs. As well as we can see at the provincial level, at the Ontario provincial level, the Ontario government implemented the Anti-Racism Act in 2017, which provided a framework for the government to identify and eliminate systemic racism while advancing racial equity in the province, and as well as initiating population-specific anti-racism strategies in the Ontario Public Service. As well, on the municipal level, in terms of Toronto, while there is no specific anti-racism legislation, there have been various informational campaigns launched by the city. So you can see here some subway ads or TTC ads that were seen, and there's also interactive anti-Asian racism web page that was linked to the City of Toronto's website as well. So, in comparison to 2003, we're in a significantly better and more prepared place to combat this rise in anti-Asian racism, thanks to a more aware legal and political environment. And thanks. So this brings me to my next point, which is that pandemics are racialized. It's important to note that only certain virus outbreaks have led to a racial backlash. COVID-19 and SARS were both linked to China, and were associated with anti-Asian racism, and Ebola, which was back in 2014, which originated in West Africa, and that was linked with increases in anti-Black racism in Canada as well. However, diseases that originated from non-racialized countries did not receive the same, racialization of disease and increases in racism that we have seen for other diseases. We can, for example, the H1N1 epidemic that originated in the US and the mad cow disease, which originated in the in the UK, did not have a racial element in the societal response. There was no, media hysteria surrounding it. And the general public treated it just as a health issue, not as a race issue. So in conclusion, I want to say that it is clear from the data that pandemics exacerbate existing racial divisions in society, and this pattern has repeated itself throughout history. Again, not just with SARS, COVID, Ebola, but it goes back further in history as well. For example, to cite another disease, the Bubonic Plague, which was in the 19th century, that was also originated in China, and it was sort of seen as it was a disease that only Asian bodies could get, whereas, like white bodies were immune. Again, it goes back to the point about racialization of disease. And so in conclusion, the scale and scope of anti-Asian racism during COVID is significantly worse than during SARS. However, we are much more prepared this time to handle this issue thanks to, things that we didn't have back then, including the influence of social media, new technology that allows us to work from home like Zoom, globalization, a more favorable legal and political environment, and stronger community action and response initiatives. And so while the problem is worse, we're also significantly more prepared this time with much more tools at our disposal. So thank you for listening.